Is testosterone also a treatment for women? Testosterone is not only one of the treatments, but it's a very major treatment for women. Women, when you look at the body of a woman, it's firm if there's enough testosterone. If a woman does not enough have male hormone testosterone, well, she will have cellulite, her muscles will be less firm, she wouldn't look as beautiful and as young as she can look when she's age 20 to 30 years, when she's full of testosterone. Women who have a lot of testosterone are more determined. They know what they want. They take decisions. They also will follow their decisions and make things come true. So testosterone is really a hormone that is important in women. And when women age, they need female hormones, but also need the male hormone testosterone. They need DHEA, which is another male hormone, but they need next to DHEA also testosterone. Testosterone has been shown that the higher the levels are in a woman, the less the arteries age, the less they have atherosclerosis, for example. Testosterone is also a hormone that makes repair of wounds quicker. It gives a mental state that permits not to be depressed. Some women are desperately depressed. You can give them any antidepressant, they stay depressed. They are collapsed. You can give them thyroid hormones or whatever. They might be thyroid deficient, but it doesn't seem to work enough because testosterone, if there's not enough testosterone, a woman gets depressed and desperately depressed. So basically, it's really a hormone treatment that women need for their health. How do you recognize the typical signs? Well, the hair can also be less volume in the hair. Muscles can be less tonic. There can be small wrinkles appearing with testosterone deficiency. The eyes can be drier too with testosterone deficiency. Even for hot flushes, testosterone can decrease hot flushes. Cellulite, as I said already, and then paler skin can also be a sign. Varicose veins can typically be signs of testosterone deficiency. It's not really reversible with testosterone, but if women have enough testosterone, they will get a worsening of the varicose veins, in my experience. So mentally, a woman hesitates a lot, not self-assured, has this sort of desperate depression, has muscular fatigue in the sense that when she does sports, she doesn't like it. She doesn't like to do sports. It's certainly not heavy sports because of testosterone deficiency, and is often submitted or extremely aggressive to her husband when she's testosterone deficient. And testosterone calms the mood down, makes a woman much less emotional and much calmer and much self-assured. So basically, this is a treatment many women need, actually. Now, you may not give testosterone, a physician may not give testosterone to a woman if there's not enough female hormones. So there must always be female hormones treatment, actually, additional to the testosterone treatment when it's given. And one of the best ways to give testosterone to women is transdermal testosterone. You put it on the inside of the arm. It can be good. You can also put transdermal estrogens, because that's usually the treatment that's given with it, with oral or vaginal progesterone, and you can put on the same places the transdermal estrogen so that there doesn't come any body hair growth. Now, doses have to be the right dose. Then there is no increase in body hair in women, or certainly not excessive body hair. But if women are deficient in female hormones, they will get body hair. So you need to give these female hormones. And some of the estrogens, if it's transdermal, can be put on the face so that it protects the face from any body hair growth or facial hair there due to testosterone. Now, some women also need to take a blocker of the conversion of testosterone, a partial blocker, not totally blocker, partial blocker of the conversion of testosterone to dihydrotestosterone, which is the hormone that gives scalp hair loss and body hair growth if it's in excessive amounts. Now, some women need to get on a higher level of testosterone because they're desperately depressed. They're so depressed and nothing helps. They're collapsed. They don't have any energy. And because they have large amounts of cellulite, and then the treatment is to give higher amounts of testosterone injections, like testosterone enanthate once a month, 50, maybe 80 milligrams, sometimes 100 milligrams, or sometimes even more in very tall women and very big women. But then at that time, you certainly have to give the blocker, and you give about 2.5 to 5 milligrams of the blocker, sometimes more, finasteride per day. So to that once a month intramuscular injections, but you really can get impressive results. I always say that these injections, when they're given, when they're rightly given, when and in the right person where it has to be given, you have a collapsed woman who suddenly becomes a brilliant woman, who become prime minister, sort of Iron Lady, and that really is very satisfying for the patient and for the doctor to see those brilliant results. You have brilliant women coming out of it. So testosterone can make really a woman better. And it's one molecule that exists in her body that she needs and may not be deficient. So treat whenever it is necessary in the right amounts with female hormones. That's my message, take-home message.